Dear viewers, we are back from this segment and we have been joined by our first guest for this evening, Dr. Ahmad Al-Basiri, resident in Kuwaiti Board of Family Medicine. Good evening and welcome back to Hala Kuwait.
Hi, thank you so much. It's always fantastic to be back on the show.
Thank you so much for being here, of course. So we were just talking right before we went live on air and we were saying how everyone was sick the past few weeks. So let's talk about viruses today.
Sure.
How can the change in weather, especially when we're transitioning from warm to colder weather, how can it affect our immune system?
Yeah, I think that's such a good question. I feel like the cold weather actually it puts more stress on the body, and that stress that is on the body, it kind of dampens and it lowers the immune system that you have, and so the body won't work as effectively when it comes to fighting off the viruses. So that switch from the warm to the cold weather, that is such an unexpected kind of stress on the body. So it affects the immune system. The other way that the transition kind of also affects the viral infection is that it keeps the airways dry. Like we were talking about this earlier, that the airways in your body, they have a natural barriers, and it's most likely very moist and humid. So when there's cold air and when there's cold weather, then that natural barrier is gone, and then you're left with a very weak kind of barrier that is more prone to having viral infections. So that's one way to put it.
It makes a lot of sense. I think I have a continuation to my question. We're all trying to figure this out. So why do viral infections seem to increase during the colder winter months? I know that we can get a flu in summer, but is there a pattern or an explanation for this?
There's a lot of theories on why it's more prominent in the colder months. So there's no one single reason. One of the reasons is usually in the countries where it's super cold and it's very cold, people don't usually stay outside. They usually go inside and they huddle together, and then they stay together. So the fact that you're staying together, that means if you have the virus, you will spread it to someone else.
That's true.
So that's one of the reasons why people get more viral infections. And I feel like this sounds very true now, because we are currently in the school season, so there's a lot of kids in school, a lot of people in school. Not even the kids, even the adults in colleges, the adults at work. So the fact that we're getting inside, that makes the transmission very easy. There's one more reason why it's more prominent in the colder months, is that in the colder months you don't get to see the sun a lot. Sometimes it gets very cloudy.
That's right. And
vitamin D is very, very important when it comes to the body's the ability to fight off infections. So I would recommend every person to get vitamin D checked, because most likely you will have it low. So if you keep it optimized, that will help.
That's right. We're very used to, especially in Kuwait, to having low vitamin D.
That's true.
Unfortunately. So I think that's really great advice. So what are the most common viruses that you think people will be contracting this winter or as the temperatures drop?
I feel like the viruses, they don't really change. They've been here for ages and decades. So the usual culprits, so I would say the influenza viruses, the coronaviruses, the RSV, the rhinovirus, those are the viruses that we actually see every single year. So we're not strangers at this point. We know them, and we've been around them, and they tend to have a variety of symptoms that can affect the body. So coronaviruses, we've seen how bad it can get with corona.
Exactly.
And the common cold that people get all the time, so that's more of the rhinovirus. So there's a variety of the viruses and the variety of the symptoms.
Definitely. So we spoke about how we're more vulnerable maybe to contracting viruses during the colder months, but are certain groups of people more vulnerable, like children or the elderly, you think?
So I mean that's exactly that. So when we say children, we say specifically children that's under the age of 5. And then when we talk elderly, we're talking 65 and 70.
Yes.
So those two groups of people are more prone to having the infections, but there's a third kind of group that is forgotten somehow. So it's the everyone person, so between the age of 5 years to 60. So the middle-aged people who have other like serious conditions, so we're talking like heart disease, kidney disease, if they have diabetes, if they have asthma, they tend to have it like tougher. So the disease or the virus can be more significant to them than the usual healthy person.
Definitely. So what are the symptoms that we should be watching out for when we're actually sick? And when should we actually seek help and go to the doctor? Because as you mentioned, we're now very used to the common influenza, COVID, all of that. When should we actually stop medicating ourselves at home and seeing a doctor?
So like I would say the common symptoms that we have usually, so we'd have the fever for 1 or 2 days, maybe 3 at max. You'd have cough, you have like some runny nose, like some sneezing. Like the cough is usually very common and we see it for weeks. Some people might have it for a week or 2. But I would say the symptoms that are kind of worrying is that if you have a fever lasting more than 5 days, cough that lasts more than 3 weeks, if you have shortness of breath and you can't breathe, if you have chest pain, or maybe like let's say if it's an elderly like person, and they suddenly become confused and they don't know where they are. That's a huge kind of like a red flag. So those are the symptoms that I would say go straight like to your center and to your primary healthcare center. And for the elderly, like if they have the symptoms, I would say just go from the beginning, just to prevent any kind of side effects later on.
Amazing. And what about precautionary methods that families can take to actually help to not contract the viruses? Because it's one thing being sick, but when it's you and your children and the whole family, no one is able to take care of the other one at that point. So
I feel like having the foundation there, where the whole family is practicing like the regular hand washing. If there's anyone sick in the family, try to limit the contact with them. So try to limit the contact with like a sick individual.
Yes.
Make sure to have the place very well ventilated.
Amazing.
You know, just like if you cough or sneeze, just like use the elbow, and that will prevent kind of spreading the infection like everywhere in the house.
Definitely, which I think is really important.
That is very important, yeah.
Definitely. And what can we do to boost our immunity? I know that we start getting a lot of advice about taking extra vitamins. Is there anything specific we should be taking? And should we only be taking it in winter or all year long?
That's a very good question. Like the second part of the question, that's actually a very good question. So like I would say a balanced diet like all year long, and this balanced diet has to have vitamin D in it. It has to have vitamin C, some zinc, some like antioxidants. So a lot of the diets will be a lot of fruits. So we're talking about like strawberries, all kind of berries, to be honest, like oranges and vegetables in general. Vitamin D, you can find it in like eggs, in like fish, in tuna. So make sure you have like a variety of like a balanced diet. But we also have to remember there's other aspects. So getting regular sleep. I know it's very kind of difficult in Kuwait here, getting sleep. Getting like regular exercise. The weather is getting like very nice now, so it's better like to go outside and like do some exercise, and just like to manage the stress of life, you know.
Yeah, that's a very big one for us. As you mentioned, sleeping could be really hard. And especially food. We have amazing restaurants, so we're always going with
it's always
the burgers. It's always a challenge.
Exactly.
So how effective are flu vaccinations and other vaccinations to reduce the seasonal viral infections?
I would say the flu vaccinations have been proven for a very long time all over the world to reduce the kind of rates of the flu that people get. And even if some people like do end up getting the flu or getting like any kind of viral infection, they will have it less severe than the people who didn't get the flu vaccine. And this has been proven all over the world in multiple like like colleges or like institutions who have done studies. So I would highly recommend getting the flu vaccine, especially if you have someone at home who might not kind of get the disease like very easily. Like they would actually suffer from the disease, and they would have like complications. So if you have an elderly at home, make sure that you taking care of that elderly, that you are vaccinated.
Definitely, I think that's very important, because sometimes we have a sibling or a parent that has like an autoimmune disease or even something more serious, and a flu could be really bad for them. So not just taking care of ourselves, but the way it could affect our family. And finally, what advice would you give to people that are more exposed to viral infections or viruses, like healthcare workers and teachers? What can they do to protect themselves?
Yeah, so like I would say, like teachers and the healthcare workers. So the teachers, they deal with kids all year like long. So there's a lot of moving around and a lot of like touching things.
Exactly.
And so I would say for the teachers, just to kind of like to like cultivate a culture, like even like in the classroom, of like regular hand washing, wearing a mask if it's necessary. Like if the teacher is starting to feel that like that they're sick, or maybe there's someone sick in, like in the classroom, then like to wear the mask, and just to kind of cultivate that culture like within the classroom. And then for healthcare workers like and teachers, I would say like definitely go and get vaccinated, because that will protect you and your like your students, or for me like my patients. So definitely getting vaccinated for sure.
Definitely, that's really important, especially in your field of work, because how much avoiding can you do, right?
Exactly.
You need to stay safe. Well, Doctor, thank you so much for being with us in Hala Kuwait.
Thank you so much for having me.
Thank you. Dear viewers, we had with us Dr. Ahmad Al-Basiri, resident in Kuwaiti Board of Family Medicine, and up next we have a report on how to avoid burnout.